Cholesterol, when we checked it, was 230. So those numbers are way out of range for someone who has coronary atherosclerosis, which is what you have. You'd like that total
Georgia does not suffer from high blood pressure, but her cholesterol levels put her at risk. Although particles of cholesterol flow through the bloodstream to help repair cell membranes throughout the body, cholesterol is also implicated in the creation of plaque.
We've known for decades that people with high levels of cholesterol were at increased risk for developing coronary disease. But only more recently do we really understand how that works.
Cholesterol is carried in and out of the body's cells in two different forms. LDL particles ferry cholesterol into the cells, including the cells in the coronary arteries. HDL particles ferry cholesterol out of them. The danger comes from the LDL cholesterol. When too much cholesterol accumulates in the artery walls, white blood cells come to the rescue, as if the cholesterol were a foreign invader. They engulf it and set off a chain of reactions that ends with the formation of the deadly plaque. Scientists call the mobilization of the immune system the inflammatory response.
The inflammatory response is very important in defending us against foreign invaders like viruses and bacteria. But when we're exposed to risk factors, such as high blood pressure or bad cholesterol, that turns our usual friend, the inflammatory response, that defends us, into an enemy that can promote the disease.
And if we can get those numbers really down, that's a really important way of stabilizing that plaque formation that's already going on in your arteries.
Assuming that I adhere to a really good, healthy diet, and I also exercise regularly, will I still have to take the cholesterol drug?
The answer is yes. Usually, in most people, diet and exercise will lower the cholesterol about 10 or 15%. And in your particular case, since we know you've already got a cholesterol issue in the arteries, that's not going to be enough, in my mind.
As well as exercising and controlling her diet, Georgia, like many patients with heart disease or a high risk of heart disease, will need to take medication, statins, for the rest of her life. Cholesterol is formed mainly in the liver. Statins inhibit the production of cholesterol, dramatically reducing the cholesterol available to invade the coronary artery wall.
By lowering bad cholesterol in the blood, you have less of it going into the artery wall. So as important as lifestyle is, it simply isn't enough, particularly for people who already have heart disease. And that's why, for people with heart disease, the use of cholesterol-lowering medication is virtually universal.
But we should never give drugs as the first line of treatment. It's always lifestyle in contemporary cardiology. And we always need to be mindful that there's a price to pay, both economic and in terms of side effects, with any drug. And we need to make a partnership with the patient in order to balance that risk-benefit ratio for each individual.